Hey, so we're back with another NHS Wellness podcast, and I have Tori Pierce here. She's the nurse practitioner for the NHS Pulmonology Clinic. We're going to talk a little bit today about her health goals, and she's going to talk to you all about how you can start addressing your own personal health from the root up. So, Tori, first I want to ask you about your goals for 2026.
My goals for 2026.
Yeah.
So, for the last couple of years, it seems like life has just been so fast. You know, I was working as a nurse. I worked through ICU and COVID times. Everything was a blur. Then I went to nurse practitioner school. I've got little kids, and so it just seems like things are crazy. But now, you know, I'm kind of settling into a routine, and my kids are getting big enough that I think this year my focus is going to be on getting more active, you know, outside with my kids and stuff like that. They're really starting to take interest in sports. I'm having a lot of fun getting back to that with them, and I'm also seeing the health benefits of how good it feels to get back in shape and to be out in nature, you know, and fresh air and stuff, and how much it is good for you health-wise and then also mental health-wise.
Right. So you have a personal weight loss story about yourself. You've lost quite a significant amount of weight.
I have a history of having like PCOS. So whenever I got pregnant with my first child, it was really hard for me to lose weight afterwards, and I stayed heavy for quite a while. And then to have my second child, I was super insulin resistant and stuff, so when I got pregnant with my second child, they wanted to put me on a bunch of medicine, but I asked to do it naturally on my own, so I took some supplements. I did basically like a keto style diet and controlled my insulin resistance on my own, and I was able to get pregnant. So then after that, I kind of took that plus some other things, getting healthy, and I was able to lose quite a significant amount of weight. And from that, one thing that you don't realize is how much it really affects you. You know, you don't gain it overnight, so you don't feel the stress that it puts on your body one day to the next. But when you start losing it, you can really see how much better you feel, how much better you breathe, how much better, like, you don't even realize how inconvenient it is to struggle to tie your shoe, you know. And then just getting that off and realizing like how much more you're able to do and how much better you feel, it's just so important.
So that going on a keto style diet, it improved the PCOS?
Yeah, so the PCOS, it's like a hormonal condition that you get, and some people kind of look at it as like next door to like an autoimmune condition. Some people, they don't know if it's like the chicken or the egg, you know, does the obesity cause it or does it cause the obesity? But nonetheless, the way to treat it is fixing the hormonal imbalance of the insulin resistance. Correcting that insulin resistance is what allowed me to get back into like a normal cycle and have a child without having to do all of the extra medications or expensive treatments or anything. So it took a little bit of time, but it was worth it.
Yeah, so you got to the root of it with your nutrition.
Right.
Okay, so tell me on a daily, what kind of patients you see?
So I see, you know, we see pulmonology patients, so patients with lung disorders. It could be something that they're born with, you know, something that they've inherited, or it could be something that they've acquired over time from like smoking or something like that. You know, you get COPD, or we have a lot of patients in our area with asthma and other things like that. So we see a broad range of patients, but a lot of them are kind of in that realm.
So how do you treat them?
It really just depends, you know. So if you're seeing a patient with COPD, you know, that's something that has developed over time. because of some kind of toxic inhalation, whether it be smoking or chemical or, industrial, they got it through their work or something, and it causes damage and inflammation to the airways. So it makes it to where they just are stiffer, they're less compliant, they don't do or move the way they used to, so then the lungs just don't function properly. So the number one way to prevent something like that is just to not smoke, because that's about 75% of people who get COPD is related to smoking, and that's one thing. It really is unfortunate because where we've come from in the history of, the United States and healthcare and stuff, smoking used to be cool. It was the thing. Everyone did it. It was promoted, it wasn't bad for you. And then by the time someone's addicted to it, because nicotine is so addicting, and it was a crutch, it's a crutch for people for anxiety and stuff. By the time that we started realizing that, hey, this is really bad for your health. This isn't only going to increase your cancer risk, but it's also going to change your ability to breathe on a day-to-day basis. And by that time, people were already too far in, addicted, or the damage has already been done and they can't stop. So now the biggest thing is either smoking cessation, if you've started or you're smoking, talk to your primary care doctor, talk to your pulmonologist, how can I get serious about this and quit? And then for the younger generation, it's avoiding starting. Don't start smoking, and definitely don't start vaping.
What are you seeing with the vapors?
So the vapors, a lot of them, it's still so new and it's changing. The chemicals that they use in them are changing, the delivery methods, the oils, everything that they add into it. It's constantly different. So you can see more of an acute issue with them. They get like an acute lung injury, and then it kind of almost just kind of ruins their lungs all at once. It's scary because, you take that risk every single time you vape, you could not breathe the same for the rest of your life. So, and I think that they've kind of promoted it as something that's like an alternative, it doesn't stink, it doesn't, whatever, it's cleaner, it doesn't have all the toxins, but it's not a good alternative. It just, we don't know long term what it does as far as creating a COPD risk or something like that, like we know with cigarettes, but it's still not good. So it's not a good alternative. Any kind of inhalation like that is not good.
When you see your asthmatic patients and those with COPD, do you still recommend that they exercise and
definitely
any diet changes? Dietary changes or
a lot of things with the lungs come down to inflammatory burden. And asthma is a primary example of an inflammatory lung disease. It's most generally driven by a type 2 inflammation, and that can be related to, in our area, a lot of people have allergy issues and sinus trouble and stuff like that. But we also have a lot of people who are overweight and don't have good diets, don't exercise well, and all of those things are related to your baseline inflammation burden. So if you have inflammation just in your body, if your lungs are sensitive, they're gonna feel that, and you're gonna wheeze, and you're gonna have a hard time controlling your symptoms as far as shortness of breath and just how many times you need steroids and stuff like that. It can be, there's a lot of changes that can be made naturally with exercise and diet changes, but exercise for the lungs, your diaphragm, everything, your intercostal muscles, it's all muscular. So walking, just good cardio exercise. A lot of patients have issues with their joints and stuff. So the best thing, we have a pool at the Fit here in town, water, exercise, stuff like that can lighten the impact. Those kinds of things are all really good because that cardio really gets you working. It helps you move your oxygen around. It helps you work on that inflammation, decreasing that. And it's a dopamine response, it makes you feel good. So when you feel good, that helps you be more motivated to do better and to want to improve your situation, so exercise is really important for multiple reasons in lung health too.
So what do you want to tell the people out there? The takeaway. What can we tell these?
The takeaway. So I guess the takeaway for wellness in general, would be, especially if you're worried about your lung health, you're short of breath, those kinds of things, look at your daily routine first and see what you can change, do you need to modify your diet? Could you exercise more? And there's a difference in, I'm not telling everyone to go learn to run a marathon, but just getting over your daily amount. Your body gets used to your daily routine, and if you're not doing something extra over that, then you're going to be short of breath if you try and walk a flight of stairs if you haven't walked a flight of stairs this week, and so just having that exercise, eating things that are good for your body and not causing all of that baseline inflammation, those are good places to start, and then if you are harming yourself or you're taking in, a lot of industrial fumes or smoking or something like that, decreasing that as much as possible and using safe practices as far as like respiratory protection and things like that will benefit you later on in life. It's all important.